Hello everyone, it's Dr. April Spencer, your favorite surgeon, taking you from your breast health to your best health. So this just in, Chris Rock could have been onto something with his documentary on good hair. There's a recent study that was just published this week that showed an increased association between relaxers and hair dyes and certain hormone-related cancers like ovarian, uterine, and breast, particularly uterine cancer. Now, researchers are still looking to see what specific chemicals have been highlighted that increase the risk of cancer. Now, this was an 11-year study. It was published Monday in the Journal of the National Cancer Institute, and it suggested that the hair straightening chemicals are causing this increased risk or increased association of these chemicals with the increased risk of uterine cancer and also some breast and ovarian cancers. Now, many of us have used relaxers either presently or in our youth, myself included, and it showed the greatest risk in women that started using relaxers before the age of 12 or for those that had a greater than 10-year use. Now, of course, this study disproportionately affected Black women, mainly because over 60% of the study participants mentioned that they had used relaxers were African American. And so it's really important that Black women, we are very thoughtful in our consumer choices. Oftentimes we feel socially and professionally pressured to use hair care products that straighten our hair or dyes that will change the color of our hair. Oftentimes because it's reinforcing the European view of professionalism and beauty. And so should we be asked as women to choose between our careers and our health? I don't think so. I think what our approach should be is just to be more mindful of our consumer choices, and we can embrace our more natural hairstyles like twists, braids, locks. But oftentimes, many of us will face discrimination in the workplace when we do embrace this more natural look. Now, a lot of professional organizations are restructuring their manual to reflect a more inclusive more of an inclusivity when it comes to what is considered professional a lot in terms of the way their employees wear their hair. And so I think it's important until we know more information, ladies, it's important that we either minimize our use or stop the use altogether of the relaxers and permanent dyes. It could be a matter of life and death. I hope this was helpful. I always want to take you from your breast health to your best health. If you have questions, make sure you comment in the section and follow me on social media at Dr. April Spencer on Instagram and also on Facebook. There are many platforms where I love to engage with those that are tuning in. And again, the goal is to go from our breast health to our best health, not just in the month of October, but year round. I love the fact that you guys follow me on YouTube as well. So you can follow me on my YouTube channel at Dr. April Spencer. But more importantly, try to get your questions answered. Be more mindful of your consumer choices, not just in the month of October. And remember, it's always the goal to go again from our breast health to our best health. Until next time, take care. And please share with anyone you think this will be helpful for.